Cameron, we want to talk a little bit today. Unfortunately, for whatever reason, some people do have a fear of coming to the dentist, don't they?
Oh, absolutely. Yeah, that's extremely common. Who loves to come see the dentist, right?
Well, but you know.
I think that's more rare than those who don't like to come.
Right.
Yeah, very, very common.
Why do you think it is? Is it going back to childhood? Are we facing traumas? What is it?
Yeah, I mean, there's the noises, the sounds, the smells. You know, I don't smell it anymore, but everyone else says, oh, there's a smell. We just become immune to it. But they could, I mean, you get numb a lot at the dentist. Sometimes none of it feels good.
Yeah.
So, yeah, all the discomfort, the anticipation of pain, any of that kind of psychs people out a little bit, and makes them fear coming, to the point for some that they just flat out don't come.
Well, that was my next question. I mean, really, is it going to stop people from coming to see you?
Oh yeah, all the time. I mean, there are some studies that show what percentage of the population doesn't come to the dentist because of fear, but just for us personally, we see it with patients that it may have been 7 or 8 years, but finally pain got so bad, they came in to get something taken care of, but it's been the fear that's kept them so long and now made it where it's an unfortunate situation.
Okay. So I guess the next question, and the logical moving along here, is how in the world do we get people over this irrational fear?
Yeah, so I mean, part of it is trying to build up some positive experiences, especially for those who have been traumatized in the past, whether it was the dentist that traumatized them or just the experience itself that was traumatic. Part of it's that, building up some positive experiences, but also helping them understand what is keeping you from coming. Is it your fear that keeps you from coming in having things done until it gets so bad that we're into more costly and more traumatic care? So part of it's that conversation, part of it's the experience, and then discussing the options to help people feel more comfortable when they do need to come see us, and they don't want to, but they need to get something done.
Okay. So there again, what are the options then that we're looking at now?
So there's a whole array of options of helping people feel more comfortable, right? Anything from just the environment that you're in. Here at our office we have, like a lot of dentists do, we have TVs in the ceilings. They can hook up with Netflix. They've got their headphones on to try to drown out some of the sound. So that's kind of a basic. There are some options to help you tune out type thing, but also there's actual sedation options. So you can do anything from just kind of a quick and dirty of laughing gas, that everyone calls it, that helps people relax. Works really well for some people, not effective for some others. Again, it depends on how anxious they really are. And then to some mild pills, stronger pills. You can go the IV route. That's more controlled and predictable. To get, to the I don't remember anything at all, to full out being put to sleep, right? So you've got the whole range of options there to treat however anxious you are.
So depending on how anxious you are, is this kind of thing available even if you're just coming in for a cleaning?
Oh, absolutely. Yeah, and we have people that do. We have some people that won't get their teeth cleaned without the laughing gas.
Oh, really?
And I haven't personally treated people in this case, but I have friends who do that. They actually have a dentist anesthesiologist come in every 4 months for that person's cleaning. Because she will not have anything. She will not be touched if she's awake. And she knows it, and she wants her teeth taken care of. So definitely, even just a cleaning can freak some people out because we're in their face, we're making noises, teeth may be sensitive. So absolutely, and sometimes people feel embarrassed. There's no need to be embarrassed. It's just that's your reality, and there's help for that. And that's part of the care that you need. So it's not a problem. It's just, again, where are we? What do we need?
How do you determine what people need? Literally them just saying, I'm not going to come in unless you shoot me full of something.
Yeah, so I like to ask people, how aware would you like to be for your visit? Because that kind of gives me an idea of how nervous are they. Because if I ask people, how nervous are you? Oh, well, I'm pretty nervous. Well, what does pretty nervous mean? Are they going to be?
You need to be unconscious?
Yeah, are they going to be just a little bit, oh, I don't like sitting here, or do they need to be knocked out? So, how aware do you want to be? How much do you want to remember from your visit? And then we can talk about what they ideally would like, what they really need, what they want to do, and sometimes those are 3 different answers. But it allows a conversation to really fill out what's their sedative need. This is what I call it. How sedated does this person need to be to receive their care?
So, really, just a really good thing to remember here at Aspen Dental. Should you need just a little something, or should you need just knocking out completely, come in and see Dr. Cameron here at Aspen Dental, and they can all help you, can't you?
Absolutely. If we need to bring someone else in to help us, we can do that.
Okay. The perfect solution. Thanks, Dr. Cameron.